asleep. We'll try and talk a little bit. Some of the talks, like I know what Kenita has spoken about, and I know what Dan's going to speak about next, is a lot on how you can do better tomorrow. But this is something, since we're having it once a year, a lot of what I'm going to talk about will not apply to you running better tomorrow, but it's more running research in general, and hopefully you running better for the next marathon. Okay, so it's not going to be very specific to tomorrow. Um, I like this line. It's a distance makes the heart grow stronger rather than fonder. So I thought I'll pick on 5, 6 topics which are sort of quite current in the running literature, or which may have relevance for you. We're talking about high intensity interval training, HIIT, you may have heard of that. Strength training and running, we'll touch upon that. Is there something like too much exercise? I know Dr. Nambiar had spoken about that in her talk. Reduced training and detraining. Caffeine and running. So you spoke about, is caffeine good for the heart? Let's see if it's good for running. And we'll finish up with talking about hydration, okay? So in each one, I'll just talk what the term means, what the science in general shows on it, and like a simple take-home message for it. So we look at high intensity interval training. So basically, runners are used to interval training. Okay, interval training is something we've been talking about all along. But this new sort of concept of high intensity is when people are going sort of supra-maximal, trying to push themselves even, above their 100%, as we'd say, interspersed with short breaks in between. Okay, so it often consists of a warm-up period of exercise followed by 3 to 10 reps of very high intensity, followed by a medium intensity. So the high intensity is done all out, okay? And some of these training regimens, like this Tabata and these various terms you may have heard of, can be as short as 8 minutes, 10 minutes. So you could be, sort of on for a minute and off for 30 seconds, and on for another minute and off for 30 seconds, okay? So what does the research show? And this is just a sample slide. Why I want to show you this is that whenever you want to look at research, and you want to look at published research, okay? So there's a site called PubMed. Pub like in for publish and med for medicine, pubmed.gov, which is a US government site, which is a compilation. So it's the Google of all medical articles or medical journal articles. So if you put something in PubMed, it's not as easy to search as Google. You got to learn. So for example, here I put in the term caffeine and caffeine and running, and it showed me, all of these different things. So all the literature I'm showing you now is from published PubMed literature. Okay, this is just an idea to give you a sample on what it is. So I looked at an article published in October 2013, so extremely recent, looking at sprint interval training effects on aerobic capacity. And when you look at the research, sometimes you have what are called review articles. So a review article looks at all the other articles published and comes out with one sort of statement on it. Okay, so this is looking at sprint interval training and this. So what they found was that sprint interval training improves aerobic capacity in healthy young people relative to continuous endurance training, which is what we are used to, of moderate intensity. Sprint SIT presents an equally effective alternative with a reduced volume of activity. So instead of going out for that 30, 40, 50-minute run, you could do that 15, 20-minute session of sprint interval training or high intensity interval training, okay? And what some of the studies have shown is that when you do this, your resting metabolic rate does tend to remain elevated for a longer period of time. And that's because of something called as EPOC. Okay, what does EPOC stands for? EPOC stands for excess post-exercise, so after you finish your exercise, oxygen consumption. You may have heard the term oxygen debt. Okay, you used to use that term in the past. What that means is that if this is your normal curve, okay, and this is getting slightly technical, if this is your normal curve of oxygen consumption, what we find is that you actually sometimes consume less because, to put it in simple language, though it's not entirely scientifically valid, you get a bit anaerobic towards the end. So one way of looking at it is that after you finish that exercise session, to make up for that anaerobic thing, you're consuming a higher amount of oxygen for the next several hours. And that excess oxygen also goes into burning excess calories and keeping your resting metabolic rate high. So for example, 1 liter of oxygen that you consume gives you about 5 calories of energy. Okay, I'm not being entirely scientifically accurate, but just to make it simple. So this EPOC increases when you do high intensity interval training. So what's the take home message? It's an effective workout, especially when there's a time constraint. It's a good way to maintain your aerobic fitness, especially in the off season. Now, you have your sort of season and your off season. So I would think probably September to March would be your running season in India at least. And then March to September would be more or less like an off season. Okay. So it's a good way to maintain your fitness in that time. But I don't think it replaces aerobic training. So if you all are going to be long distance runners, which all of you sitting in this room pretty much are, you can't suddenly do this high intensity, interval training all throughout the year and think that that's replacing your long distance running. Okay, so that doesn't happen. Okay, let's quickly look at strength training for runners. This is something which you're more familiar with, so I'll go through it a little bit quicker. We've got different types of muscle fibers, okay? We've got type 1 and type 2, to remember it in a simple manner. Type 1 are what are called slow twitch. That's what helps in your long distance endurance training. And your type 2, there are two types of type 2. There's a type 2A and a type 2B. So the type 2B is for sprinters. So somebody like an Usain Bolt or a Carl Lewis or a Ben Johnson, okay, they would be blessed with lots of type 2B muscle fibers. So when they were born, if you did a biopsy on their leg, you would say that this guy can be a world-class sprinter, and none of us can. So sprinting is largely genetic. Long distance running is got more of a, how should I say, training element, while sprinting is largely genetic, okay? So type 2B is what the sprinters have, and 2A is in between. It's not slow, and it's not completely fast, okay? So it's sort of an in-between. What strength training does is it helps you train also some of those type 2A and 2B muscle fibers, especially 2A. Okay, so looking at this research, I looked at this article which said the effects of resistance training on endurance distance running performance among highly trained runners. And a guy called Will Kramer is part of this research, and Will Kramer is one of the leading world authorities on strength training research, okay? So what they found is we conclude that resistance training likely has a positive effect on endurance running performance. Now all scientists like to, put their language very, sort of to not to get sued ever. So they'll write likely. They will not write definitely. They'll use words like likely when they're describing it, okay? So what are some of the benefits? Increase bone mineral density. You also reduce your risk of injury, okay? Improves your tolerance to several daily life activities. And in types of resistance training, there are three, if you can broadly divide it. One is your circuit training, where you're doing a little bit of everything at not a very heavy weight. The other is what we call a traditional weight training, where you're doing, 3 sets, 4 sets of 5, 7 different exercises for your upper body and lower body. And then you got what's your explosive training, a lot of jump training, a lot of plyometric type training. And each of these has a different effect on your muscles. So your circuit training also helps the cardiovascular system a little bit, especially if you're starting off. So if somebody is not really an athlete, not really a long distance runner, and they do some circuit training, it's going to give them some aerobic benefit as well, but not for people like y'all. Traditional weight training helps running economy. That's what they found. Your running economy is helped when you do regular weight training, along with the added benefit of improving what's called your neuromuscular coordination and anaerobic performance. So a lot of this, the last 1 or 2K in your 21K run, if you've been weight training and it'll help you push yourself a little bit harder. It's training also your anaerobic system, what's called your creatine phosphate system or glycolytic system, to give you energy very quickly. And the explosive training, which is the plyometric type, also helps the running economy as well, and that's supposed to help it most, okay? So you have your circuit training, you got your traditional weight training, and you got your plyometrics. So for a group like this, I would say that why not get into plyometric training since you're already quite advanced? Okay, so what's the take-home message? Strength training is beneficial for runners. During competition time or season time, you should taper it down. So for example, this week you shouldn't be like doing plyometrics 3 days a week on the week before your marathon, okay? And different types of strength training gives you different benefits. Okay, excessive exercise that Dr. Nambiar touched upon. So this was an article in last year in the New York Times, Can You Get Too Much Exercise? This was an article 2 days ago in the New York Times, what ultra marathons do to our bodies, okay? And this was actually a very positive article. And then there was this article she referred to, which set the cat amongst the pigeons last year, Mayo Clinic Journal, Potential Adverse Cardiovascular Effects from Excessive Endurance Exercise by a guy called O'Keefe, and it's gone viral on TED Med and TED Talks, and a lot of runners came to me. I can see people nodding here, my God, should we stop running? And so let's define what they found. Okay, this is technical stuff. Well, let me just explain to you. Firstly, the term excessive hasn't been defined. It clearly goes into people who are running several ultra events a year. Okay, so I would think of people doing at least 70, 80, 100K training volume on a week-to-week basis. Okay, 99% of Indian runners would not come close to what we would call that excessive running. So what did they find? Okay, now these slides are a little bit technical, but since you all are a more knowledgeable group, let me tell you. They found that your heart is a muscle, right? The heart muscle is called your myocardium. So they found that in a lot of these runners, they had scarring on their myocardium, which was called myocardial fibrosis. That's what it's called. And they find that because of that fibrosis, the runners sometimes might be prone to have irregular heart rates. And which is why that irregular heart rate, when it gets very bad, is what ultimately causes that cardiac arrest. Okay, so the protagonist, the hero of Born to Run, what is the name? Caballo Blanco, the guy who he writes about. Caballo Blanco was found dead in the middle of a run in the forest, and some people say, what a way to go. But so the question is, this is a theory, this is a hypothesis. It's not yet been proven because we don't know whether that fibrosis is reversible or not. Okay, so the jury is still out there. So now what they're doing is they're doing MRI studies on the heart to look for this fibrosis. And the last year at the meeting of the American College of Sports Medicine, the guy who's the Andre Lagersh from Australia doing the leading research in the world, he showed his own MRI, and he's an ultra runner, and which showed the scarring. So I stood up in the audience and asked him, so should every runner have an MRI, a myocardial? He's saying, no, we shouldn't, because we know that this scarring happens, but we don't know the effect of it. We've still not understood it well enough that could it, is it reversible, is it irreversible? But the point I'm trying to make is that, look, we're all great fans of running and everybody believes in it, but just these studies are opening up our minds that, okay, there is a question, maybe there is something excessive. We don't know that yet for sure, okay? So take-home message is that the benefits of exercise are clearly proven, so we're not talking about normal training. There is some suspicion that all athletes' heart may not be entirely physiological. An athlete has a larger heart as well, so some of them may not be physiological. It may be a problem. And if you're increasing your training volume above 100 kilometers a week, then I think you should have a talk with your doctor, someone who's knowledgeable about these things, that, look, is there any downside, okay? So I would say less than 70, 80 kilometers a week, I don't think you need to sort of start worrying, am I training too much, all right? So I like this joke. It says, running is bad for my knees, not running is bad for everything else, okay? So all your friends, family, everybody's going to tell you you're running too much, you're doing too much, you need to slow down, right, Adil? That everybody's like, you're doing too much. So you can show them this. This was published in Med Science, Sports and Exercise, and I met this guy, Paul Williams. He looked at the effects of running and walking on osteoarthritis and hip replacement risk. What does it say? Running will spoil your knees, right? He looked at 75,000 runners. Okay, I met this guy. He looked at 75,000 runners. And to put it in simple words, he found that they had less knee and hip problems than the so-called average person. Okay, so the next time someone freaks you out about it, 75,000 runners. This is not a small study. I can send you the link, okay? So let's look at something else called reduced training. Now, why is that important? Now, all of you are runners, all of you are diehard, but there will be times in your life because of illness, because of maybe travel, things come in where you might not be able to train quite as much as you want to, and you're scared that you're going to lose all the good effects that you got, right? So let's see what we can do to prevent it. And this is one time I've used an old study, it's an 85 study by a guy called Hickson and Mike Pollock. Mike Pollock is the father of exercise physiology, where they looked at reduced training intensity and loss of aerobic power and endurance. And I'll tell you what they did. So they took the subjects and they trained them for a 10-week period. They made them exercise 6 days a week for 40 minutes at a fairly good intensity, which is a reasonable training load that most of us sitting in this room would probably do, right? 5 to 6 days a week for 40 minutes. After that, they reduced their training. They said, let's play with 3 things. When you're training somebody, you have 3 things you can play with. Duration, how many minutes is their exercise? Frequency, how many times in a week are they doing it? And intensity, which is how hard are they doing it. So they took these subjects and then they divided them into different groups. So in one group, they made the duration, instead of 6 days a week, they made it 4 days a week. Another group, instead of 6 days a week, they made it 2 days a week. Okay, the same thing they did for time. Instead of 40 minutes, they reduced it by 1/3, then by 2/3. And the same thing they did for intensity. They reduced the intensity by 1/3 and then by 2/3. And you know what they found at the end of the study? And they looked at them for 10 more weeks. That if they reduce their frequency, to two-thirds, it did not make a difference to their aerobic power or performance. Even then, they reduced it by two-thirds. It made no difference. Assuming the other two things were same, right? Every time you change only one variable. So the frequency was reduced and your intensity and time was the same, no problem. For 10 weeks. If they kept on going forward, yes, they would lose it. Second, they reduced their time of each session, from 40 minutes to one-third, two-thirds. Again, they found hardly any difference. But when they reduce intensity, everything went kaput. So bottom line is, when you got times in your life where you're not able to exercise and put the volume you would like to, make sure the intensity remains the same. So if you're a 5-day-a-week training person, you could make it 1 or 2 days a week for a period of time. And then, of course, you got to get back. If you continue that 1-2 days a week for a very, very long period of time, it will go down. But you can maintain the gains if you maintain your intensity, okay? So intensity is important. So take-home messages: when reducing training volume, it's okay to reduce duration or frequency and still maintain fitness. However, do not reduce your intensity. Keep your intensity up, unless, of course, you're ill or something, which is different. Yeah. Yeah. Okay, so let's just quickly address that. The taper is a different ball game altogether. That's a hugely planned kind of event. And I know that Dan's going to touch on tapering. But so tapering is different. That's a very planned reduction of intensity. And even when you're tapering, I don't think that there's any need. You typically taper the distances you run. I would say, personally, I don't think you need to reduce intensity. Yes, the week of the run, okay, marathons on Sunday and on Thursday, you went to sort of stretch out your legs at a slow pace, that's fine. But I wouldn't personally reduce intensity in the taper 2 weeks before. You agree, Dan? You keep it, instead of doing a 20K on the Sunday, you might do a 12K. But you don't do the 12K at half the pace that you would have done your 20K. So that you don't change intensity. All right. Caffeine and endurance running, this is something which is kind of, coming up in the literature. At times it's legal, at times it's illegal. What's the position right now? WADA is legal, illegal? Legal? Any amount? Okay, good. Okay, so I was looking at, does caffeine added to carbohydrate provide additional ergogenic benefit for endurance? That was the study I looked at. I also looked at creatine and caffeine used in sport by a guy called Tano Polosky, who's excellent in this work. And I'll just give you sort of the bottom line, what they found. So basically, we know that glycogen is the main fuel, which is basically glucose for long distance training. And what they find is that people who took caffeine, it helped them, one of the theories, is to use fat more for energy rather than glycogen. So you spared the glycogen. And if you spared the glycogen, it's like sparing the petrol you have more for later. Okay, so that's the theory. Another theory was that people who took caffeine felt the workload to be slightly lighter. It gave them a sense, their rating of exertion or rating of the perceived exertion when they were on caffeine was lighter compared to when they were not on it. Okay, so those are the two theories on which it works. No. So the research has shown that roughly, caffeinized guys, they ran about a 4.2 second faster 1.5K time. 1 to 3% was a faster 5K time, 24 second faster 8K. They didn't find too much change in their half marathon time. But a lot of studies have shown that they found that there's an improved treadmill time to exhaustion. So let's say you ran at a moderate pace, not at race pace. The amount of time you could go when you were caffeinized, if I can use that phrase, was longer when people were on caffeine. What are the typical doses in the studies? Roughly 2 to 9 milligrams per kg. So if you're a 70 kg person and you're taking 3, then it would be about 210, 250 sort of milligram. One cola typically has 40 milligrams, coffee has about 100, tea has 20 to 100, and Red Bull's got a massive 115. Okay, so I'm not saying that you need to do it, but I'm just putting out this literature for you. Okay, so 2 to 5 milligrams was the one most used in studies, and they found them effective. So what's the take-home message? Caffeine has been shown to improve endurance in some studies. You could try it during your regular training and see whether it improves your personal time to exhaustion. Please, tomorrow morning at 4 o'clock, don't knock down 4 or 5 coffees, okay? Huh. Huh. Yeah. It gives you energy? Yeah. Adil has done a 600K breve, so he knows what he's talking about. Okay. So that's good news. So tomorrow morning, nobody takes caffeine, okay? Unless you already anyway used to. Don't try something new on race day. I know Dan's going to emphasize that message, but do not do new stuff on race day. Okay, so let's get to the last 2 points. Water, okay? So you heard that phrase, water, water everywhere. But I've changed it to, but how much should I drink? Okay, so people talk about water and sugar because otherwise you tend to hit the wall. Wall is more when you're depleting your glycogen. In typical studies, that happens somewhere at the 20-mile mark in a marathon, which is a 32K mark. So you're depleting your sort of glycogen stores in the body. And we also talk about hydration and dehydration. So dehydration basically is lack of adequate body fluids to carry on the normal functioning. And this could be due to fluid loss or inadequate intake or a combination of both, okay? Severe dehydration can lead to negative consequences. So what you have, we know all this, dry mouth, thirst, irritability. This we know, the message of dehydration has gone out long and far. Something else that we've been talking about in recent times, in fact, Shamal talked about Dr. Tim Noakes. He was one of the first guys to talk about this concept of hyponatremia, which is low sodium in the body. And that happens because people are taking excessive fluids. So what is it? What are the causes? Too much fluid over too short a time span, a lot of sodium loss through your body sweat. Smaller runners are more at risk. Women are at greater risk as they tend to lose more sodium. Slower runners are at increased risk. What happens is the guy who's finishing the marathon in 5.5, 6, 6.5, 7 hours, he's, coming down Pedder Road, it's whatever, 9:30, 10 in the morning. So he is tired. I mean, and, he's basically tired because it's a fitness issue at the end of it. But psychologically, okay, let me take some more water and I'll go further. So the slower runner is the guy who's taking more and more water. And it's not the water that's the problem. He's just tired for other reasons. And he is drowning his sodium, in a sense. The sodium and potassium are two things in the body controlled very tightly. A few millimoles up and down is life and death. Okay, sugar or other things, cholesterol, whatever you have, are not controlled tightly like sodium, potassium. A few things up and down doesn't sort of, kill a person. Okay, so hyponatremia we are discovering. This is a book written by Tim Noakes called Waterlogged. And the symptoms actually quite similar to dehydration. So, sometimes you get confused. Nausea, muscle cramps, disorientation, slurred speech, confusion. A lot of this also happens in dehydration. So the last 2-3 years at our medical tent, we are now carrying an entire, kit which can measure person's sodium, potassium post the run. So you can take a blood test and, check the sodium, potassium. In fact, I've told our people in the tent tomorrow that every single person that we start an IV on, and God knows we start lots of IVs, we will do a blood count and let's just record it and see how many had low sodium and see what our situation is. Okay, because we are, after all, are in a country where our heat and humidity are in the red zones. Okay, so a lot of the literature is also Western, where their running conditions are also much less. So, I really fear much more for dehydration rather than hyponatremia at this point in time. Okay, so your color of your urine also is a good way to go. This is sort of clear is good. If it's dark yellow, that's not good. Okay, so you can do a simple pee test to know whether you're hydrated adequately or not. So we actually did a study with Asian Heart, and You Too Can Run did a study. We did about 143 subjects across various locations. It was Bombay, Pune, and in Bangalore. And we found that the sweat rate in our Indian conditions was anywhere between 500 ml to 2,400 ml per hour, or 0.5 liters to 2.4. Now think of the consequences of this. If a person's a 5-hour full marathon finisher, okay, which is a reasonable time, it's not too fast, and by no means is it too slow. If he's sweating half a liter, in 5 hours he's lost 2.5 liters. But if he's sweating 2.4 liters, in 5 hours he has lost what, 12 liters? So there's a big difference in losing 2.5 liters and losing 12 liters. Now, we can't give the same advice to both these people, okay? So there's a big difference. In fact, today in Times of India, they wrote about it, and the very misleading headline, you lose 12 liters of fluid in a 5-hour run. It should be you could lose, rather than you do lose. It's a sensational headline. So it's not that you lose, you could lose, so that's important. So again, earlier we used to just keep on saying drink, 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 drink. Then it is drink according to thirst. But there are people who say when you're thirsty, you're already dehydrated. So what does the science say? That up to 2% dehydration actually is quite normal, and in fact might be quite good for performance. So I would say a good rule of thumb tomorrow is to consume fluids every 15 to 20 minutes that you're out there, okay? I think that's a good rule of thumb, and every 15 to 20 minutes you will come across a water station or a drink station. And it's recommended that the fluid that you take in is on a cooler level. So if you took, I don't know, again, if you don't know your sweat rate, you don't know all this science, I would say if you took about 200 ml, 150 to 200 ml every 15 to 20 minutes, you can't go wrong with that. That's a very average rule of thumb I'm giving, okay? By no means is that excessive, and by no means is that too little. Now, some people, I know like Mr. Patel sitting here, he sweats a lot, so now he needs more fluid. Some people need less, okay? So it's also quite individual. And this is a picture. We did this in Pune, and Nikhil's out here, right? I saw him sometime back. So, this was the one when in Pune, the Pune runners, we got together and we did their sweat rate study. Okay, so take-home message, fluid replacement should be optimized. So earlier we used to say just keep drinking. Now we're using words like optimized. 2% dehydration does not affect performance, and be aware of hyponatremia, okay? So I'd just like to end. These are pictures from Asian Art. Our patients take part in the marathon every year. And so this year we got 100. 3-4 of them are sitting here. They're doing the half marathon, including Venkat. This was a picture of 2013. And so hopefully tomorrow we'll have a very nice picture. I'd like to finish with this lovely quote I saw. He said, at mile 20, I thought I was dead. At mile 22, I wished I was dead. At mile 24, I knew I was dead. And at mile 26.2, I realized I had become too tough to kill. So hopefully all of y'all are too tough to kill. So I think we got 4 minutes, so we can have some questions. What would you advise to have tomorrow morning? So Dan's going to touch on, you are, right, Dan? What would you have tomorrow morning? Nutrition? Yeah. She's already touched. Okay, so I guess yours. Let Keenta quickly answer that. So I don't want to
early morning? Tomorrow morning before the race? Okay, so firstly, try and do what you've always done during your training. So I wouldn't recommend doing anything new. So if you're used to taking banana, oats, or say cookies or whatever you're used to. But I definitely recommend something that is bland, easy to digest, less in fiber. So, and easiest recommendation would be a couple of small bananas or 1-2 tablespoons of oats cooked in water, and then just start sipping your water, fluids, or sports drinks. So, but a couple of hours before.
Yeah. Yeah. Half marathon? No. See, I think not drinking water at all through the run, I can't support that. I mean, I just don't think that's a good idea. I mean, I don't know why you would not do that. Why? Yeah, but see, I mean, it's politically incorrect to say, but you're a man, what's your problem? And there are lots of portalets on the way. On the ceilings, last time I saw like people had gone. So drink water. For that reason, don't not drink water. So see, now when you're throwing in words like underwent a complex cataract, that throws me off, okay? So if you said you underwent a regular cataract, it's fine. Now, complex cataract, is your lens dislocated or something, then you talk to the ophthalmologist, because then there are consequences. But if things were uncomplicated, it's fine, to answer the cataract question. To answer the diabetic question, honestly, exercise has an insulin-like effect. So exercise is going to bring down your sugars. Now, in diabetics, there are people who are extremely tightly controlled with one small medicine. There are people who take tons of insulin and still not control. So it depends where on the spectrum you are. If you're tightly controlled, don't give it a second thought, just do everything fine. If you are on insulin, then you need to know how your body reacts to exercise. And you kind of tailor your insulin along with your exercise. So before a long run, 21 kilometers or 42, reduce your insulin or don't take it in the morning, as a simple answer. Yes. I agree with you, but that's what I'm saying now. So when you say caffeine hydration strategy, don't do it tomorrow in the first place. So do it in practice. Really, people react differently even to caffeine. Caffeine is supposed to keep people awake. I can take coffee at midnight and sleep in 10 minutes. So it is a bit dehydrating, but again, I think it's very individual. So there's no specific strategy that at least I came across. My weight. Okay, so Gatorade basically is sugar and water. So half a full marathon. Okay, so if you're doing the full marathon, then you need to look at the strategy of how much carbohydrate you need. So roughly it says anywhere from 30 to 50 grams of carbohydrate per hour. So you calculate how much is in your one bottle, which is I think about 25 grams, and so you can accordingly do that. So I think we got time for one more question. Yeah, anybody? Okay. So thank you very much. I hope you have a wonderful run tomorrow. More than wonderful. I hope you have a safe run as far as I am concerned. I just came from the expo where I spoke to them about things. Just one quick point. If you're not well or you're not 100%, please don't run tomorrow. I know it's a horrible thing to say, but really that is what gets people into trouble, okay? I know you're a diehard people and everybody, you or your friends are not well, don't do it because bad things happen. 2 years back, a very close friend of mine, who probably a lot of you sitting in the audience will know also, so I won't name him. I got a call and I found him unconscious. The first call I got, that was somebody I know for the last 25 years. And it turned out he's been having fever for, since Thursday, Friday, Saturday. We said, what the hell, I've trained so hard, I'll go and run. Collapse when you reach intercontinental, okay? So if you're not well, don't run. If you get any pain, discomfort, what I call navel to nose, so anywhere kind of from ear to ear, slow down, stop. That's not the kind of pain which you want to push through and no pain, no gain kind of thing. You need to slow down.